And before we proceed, I'm just going to ask counsel to agree on the record that under our current national emergency, pursuant to Section 319 of the Public Health Service Act, that there is not an objection to the court reporter administering a binding oath to the witness remotely. If you would, just state your agreement on the record.
Jeb Butler, on behalf of plaintiffs, we agree.
Kevin Spanner on behalf of the defendants, and we agree.
Okay. Is there anything that you need to put on the record before I swear the witness?
Very briefly, yes, this will be the deposition of Dr. Paula Nicola, taken for purposes of use at trial and everything else that's possible under the Civil Practice Act. We'll record the video on Zoom, and we intend to play that. We may play that at trial. And I usually do this before we go on before we swear the witness. I wanted to show the NOD, which I've got marked as Exhibit A. And if this was a old school in-person deposition, I would show it to everybody. But anyway, here it's marked to be a part of the transcript. And that's all I got.
Kevin, was there anything you needed to put on before the witness is sworn?
Nothing for me.
Okay. Dr. Nicola, is that how you say it?
Yes.
Okay. Dr. Nicola, if you would raise your right hand for me, please. Do you swear or affirm to tell the truth in this matter pending before us on the 9th of April, 2021?
I do.
Okay. Witness is sworn.
Well, Doctor, first, thank you for taking the time out of your practice to talk with us today. We appreciate it. State your name for the record, please.
Paula Nicola.
And what is your occupation?
I'm a physician practicing ophthalmology in Chattanooga, Tennessee.
Do you both live and practice medicine in Chattanooga, Tennessee?
I do.
Are you licensed to practice medicine in Tennessee?
I am.
Was Mr. Harrington Zelaya your patient?
He was.
I'd like to ask a little bit about your sort of background and medical qualifications. How long have you been an ophthalmologist?
Since 2006 is when I completed my training.
Do you have an active ophthalmological practice in which you see patients throughout the week?
I do.
Are you on call for a trauma center?
I am, usually 2 days a week.
And what trauma center is that?
Erlanger Hospital.
Do you also teach?
I do through the family practice program here.
Tell us just a little bit about that, if you would.
It involves residents rotating in my office to shadow, and then also me occasionally giving PowerPoint lectures to both family practice and the pediatric residents.
Is that with the University of Tennessee College of Medicine?
It is.
What does it mean to be board certified in a particular specialty in medicine?
So for ophthalmology, it means that we took a written test after we completed our residency training. And then you also have to take an oral test for ophthalmology, which is just administered after you've passed your writtens. It's 10 separate people you go in front of and have to answer a question that you don't know ahead of time, some kind of a case, and discuss the options for treatment.
Okay.
And then every year you have to repeat a written test.
Are you board certified, and if so, in what?
I am an ophthalmologist.
Tell me just a little bit about your educational background, if you would.
I have an undergraduate degree in chemistry from the University of South Alabama in Mobile, Alabama. Then I completed a master's in molecular biology from the University of West Florida in Pensacola, Florida. Then I did medical school at the College of Medicine for the University of South Alabama.
Did you do a residency?
I did. I did a transitional year internship in Chattanooga. Then I did part of my ophthalmology residency here in Chattanooga, and I completed my final year in Houston, Texas.
Okay. I will share my screen now. And I'm showing what's been marked as Plaintiff's Exhibit 50. Can you see that?
Yes.
And we'll scroll through it just quickly here. Does this appear to be your CV or curriculum vitae?
It is.
All right. We tender into evidence Plaintiff's Exhibit 50. And at this point, plaintiff also tenders Dr. Nicola as an expert in the field of ophthalmology.
No objection.
Dr. Nicola, I'll ask you as we talk today about Mr. Zelaya for some opinions. Will you give all your opinions to a reasonable degree of medical certainty?
I will.
Okay. I'd like to start by asking you a little bit about Mr. Zelaya's medical treatment. I think in addition to providing treatment for him yourself, you reviewed at least some of his medical records from before he got to you. Does that sound right?
That is correct.
What can you tell us about Mr. Zelaya's initial appearance at the emergency room, I believe at Erlanger Hospital on July 4, 2018?
Yes, he presented to the emergency room following an injury. Could you mind if I refer to the records?
Oh, no, please.
Just making sure.
Yeah, it's not a memory test.
Well, I was like, I don't want to confuse left and right eye. And anyway, so he presented with a left eye injury. He was first seen by Dr. Yablet, who was the ophthalmologist on call, who noted that his pressure was elevated in his left eye. He had no vision out of the left eye. He had significant injury to the left upper eyelid, some necrotic appearing tissue.
Did they find anything about the lens of Mr. Zelaya's left eye?
They did. So this was mainly shown with a CT that was obtained when he went to the emergency room. But the lens sits behind the colored part of the eye, the iris, and it was actually pushed forward anteriorly, which is what caused the pressure to be elevated in that eye.
Okay.
So it's dislocated is the word that you'll probably see in the medical.
Say that word again, dislocated?
Subluxated.
Subluxated.
That means, right. That means it's just displaced in one section, but it's still partially attached. If it were dislocated, it would be completely freely moving in the posterior part of the eye.
Okay, we'll look at a diagram here in a second.
Okay.
But do you recall, were there any notes about bleeding inside his eye?
There were. It was noted by Dr. Yablik and then also on the CT report that he had a lot of hemorrhage within the eye itself.
Okay. I'm going to show you now what I've marked as plaintiff's exhibit 51. Can you see that on the screen in front of you?
I can.
Does that appear to be a reasonably accurate diagram of the human eye?
It is.
And then I see a label down here that says lens. Is that what you were talking about being dislocated?
Yes, the lens was subluxated.
Subluxated, excuse me.
So I have my own copy of that. So that just means, do you see the brown part of the eye called the iris?
Yes.
So when it's subluxated, it means it came forward through the pupil and was compressing on that brown tissue.
Okay. And we spoke a minute ago about, I think I just used the word bleeding inside the eye, but would that be bleeding inside this sort of part that's colored orange in plaintiff's exhibit 51?
Yes, you have to think of it in 3 dimensions.
Okay.
So it's a hollow object and it had bleeding inside of that space.
All right. And I believe you mentioned a CT scan. Oh, excuse me, plaintiff tenders exhibit 51 into evidence.
No objection.
I'm looking at plaintiff's exhibit 61 now. What are we looking at here? Can you see it?
Yeah, let me see. I have to blow it up a little bit.
Okay.
Yeah, so that's the CT report that I have. So the important part to note there is already highlighted, where it talks about the severe destruction of the left globe with evidence of vitreous hemorrhage.
And then here's that part you mentioned already about the lens appears subluxed, right?
Correct.
Okay. Do you recall who Mr. Zelaya saw after he left Erlanger?
He saw Dr. DeCruz, who is a retina specialist.
Did Dr. DeCruz make any findings that are significant to you?
Just he continued to support the findings that Dr. Yablitz had from his initial exam, that the patient had severe damage to that eye and that he was completely blind out of the left eye.
Do you recall whether Dr. DeCruz offered any views about Mr. Zelaya's prognosis?
Yes, he did not think that he would be able to get any vision back due to the severe damage from the initial injury.
Okay. And I'd like to move now to your treatment of Mr. Zelaya. Do you recall how many times you saw Mr. Zelaya?
I can tell you exactly how many times. So I saw him 6 times, counting when I did surgery on him.
Okay. And that I know you ultimately did a evisceration surgery on Mr. Zelaya, but if you would tell us a little bit about what you observed and sort of what you were thinking from a medical perspective before that surgery.
Okay. When I saw Mr. Zelaya in the office, he had been suffering with discomfort and pain with this eye since the initial injury in July of that same year. He had seen 2 other ophthalmology specialists who had recommended that he consider having the eye removed because he was not going to get any vision back in that eye. At the time I saw him, he had no vision in the eye. He was complaining of pain in that left eye and eye socket. And he had some scarred appearance to the eye. And the term that we usually use is ptysis.
What does ptysis mean?
Ptysis means the eye has started to shut down on itself and all of the internal structures are scarring together. So the eye actually shrinks. Like if you think about how a scar contracts, just think of it contracting in 3 dimensions, the whole volume becomes smaller.
Okay. Does that normally hurt?
It doesn't always have to, but it can.
If I think I remember Mr. Zelaya reporting deep and throbbing pain. Is that right?
That's correct. And that would be with ptysis.
I'm sorry. Say that once again. I interrupted you.
So that would be consistent with ptysis developing in an eye.
Okay. I'd like to show you that diagram of the eye again. So I'm bringing it up now. Plaintiff's Exhibit 51. I think you mentioned some scarring a minute ago.
So the scarring is actually in the center part of the eye, that's where the vitreous would be, which is tissue that you kind of have to imagine the presence of, but it fills that cavity. All of the blood vessels that did run through there and along the surface of the eye, they all scar together. And that's what I'm talking about with scar tissue forming.
So it would be in the interior of the eye, I guess.
It would. Now he also had, let me just refer to my notes really good.
Sure.
His iris was also malformed when I saw him, which was consistent with severe trauma. That's the brown part of the eye. And then eyelid was also not opening and staying open completely because that eye had started to shrink down. And it's actually the volume of the eye that keeps our eyelids in normal position.
So the shrinking of the eye was affecting his eyelid?
Well, it just makes it not stay in the right position. So if you looked at him, it would look like the left eyelid was droopy. But it's not really anything wrong with the eyelid per se. A lot of times it's because the eyeball behind there has shrank, so it can't hold the eyelid up in the right position.
I see.
And that goes along with ptysis.
Tell us about the surgery that you performed, if you would.
I performed an evisceration where I went in and I removed the front part of the eye there, the clear part called the cornea. I also removed the iris, any remaining lens material. And then I scoop out the entire contents inside of that scleral shell with something called an evisceration spoon, clean the interior of the shell, and then place an implant in that space. And then I suture the white tissue together in front of it, kind of like closing a purse, so that some of the volume is replaced after you've removed the eye contents.
You mentioned the scleral shell. Is that the thing that's shown in white here on the diagram that's Plaintiff's Exhibit 51?
It is.
Okay. When you were, I guess, in his eye, could you observe the scarring?
Let me look at my op report really quick. Yes, he did have dense scarring.
So why did you recommend and then perform the evisceration surgery? Or why take out his eye?
Because of the complaints of chronic pain that he was having. I would not expect that those would improve or get better without surgical treatment.
Okay. Was he ever going to be able to see out of that eye again?
No.
I'd like to review with you a few more pictures here, and I will show you now what's been marked as Plaintiff's Exhibit 52. Do you see that on the screen ahead of you?
Yes.
What are we looking at and how did you use it?
Those are Westcott scissors. Those are it's just a fancy name for the scissors that we use in surgery to go in and remove the different structures like this cornea, the iris, some of the scar tissue that was inside the globe, or the scleral shell is another name.
I'm showing you now what's been marked as Plaintiff Exhibit 53. What's that and how do you use it?
That's the evisceration spoon, and it's really just like a small little spoon that I use to go in and try to scoop out the contents of the scleral shell so that then the implant can be placed in there instead.
And in Plaintiff's Exhibit 54 on the screen in front of you now, what are we looking at?
That's the hydroxyapatite implant, which is placed inside of that scleral shell to help restore some of the volume that was lost from the scarring from the injury and then the removal of the intraocular contents.
Okay. Now, the hydroxyapatite implant that we're looking at now, is that different than, I think, what you would call a prosthesis?
It is.
Okay. Before I move on, plaintiff tenders into evidence, plaintiff's exhibits 52, 53, and 54.
No objection.
And I'm now showing you, well, I'm not showing you the one I meant to. Let me try again. I'm showing you plaintiff's exhibit 57. What are we looking at here?
This is an example of a prosthesis that I have in my office to show patients for what to expect after they've had an evisceration. A lot of times you will think that it's going to be a round globe type, like a ball or something that gets put in there. It's not. That's already been done at the time of surgery. Afterwards, they have this prosthetic made by an ocularist, which actually goes underneath the eyelids and is held in place by the eyelids, kind of like a thick contact lens that actually covers the surgical site and is painted to match the other eye many times.
And then plaintiff's exhibit 58 on the screen in front of you now, is that another picture of a prosthesis, or I guess the same one?
It's the same one. It's just showing more the shape of it. It almost has a little bit of a triangular shape, and it's definitely not round. It's has more of a curvilinear surface to it.
Do you happen to have that in the office with you now?
I have it somewhere in the office. Do you want me to see if I can find it really quick?
No, that's all right. The pictures will do. Plaintiff tenders, plaintiff's exhibits 57, 58 into evidence.
No objection.
And let's see, I want to show you one more thing right now. These are a bunch of records that I think you've had the opportunity to review before today. They're marked as plaintiff's exhibit 55. I will scroll through them quickly, but my question is going to be whether these appear to be true and accurate copies of your medical records relating to the surgery you performed.
It looks like it's the same thing.
Okay. Let me get to the bottom for the official bit, and then I'll officially tender them. Those appear to be the medical records we talked about.
Yes.
All right. Plaintiff tenders plaintiff's exhibit 55.
No objection.
I wanted to ask you next, Dr. Nicola, about some of the effects of losing one eye. And I'll start with the very basic stuff. Is Mr. Zelaya's left eye ever going to grow back?
It will not.
Will he ever see out of it again?
He will not.
Are you familiar with the concept of impairment ratings for injuries to the body?
I am.
What does an impairment rating mean?
An impairment rating is usually done after someone's had an injury or even an illness, I'm assuming could be done, but I always do them after injuries, where they have permanent damage to a part of the body. In my example, it'd be to an eye, and it's the effect of the loss of that to the whole body.
What is Mr. Zelaya's impairment rating to his whole body as a result of the loss of his use of his left eye?
So I haven't done a formal impairment rating on him, but I would suspect it would be around 25%. That's normally what it would be when someone has lost complete vision out of one eye.
And when you give us that figure of around 25%, are you relying on something called the American Medical Association Guide to the Evaluation of Permanent Impairment, 6th edition?
I am.
And is that what we're looking at now in Plaintiff Exhibit 60?
It is.
All right. Plaintiff tenders Exhibit 60.
Objection here, so.
Okay, our response would be that it's the admissible under 702 because it's the kind of thing an expert can reasonably rely on, but your objection's in the record. All right, does losing an eye affect someone's peripheral vision?
It does. So on the side of the eye that has been lost, they'll have about a 25% reduction in their total field of vision.
What are some of the consequences that you see in your patients following that reduction in the field of vision?
They'll have difficulty with things that come up on that side quickly. So particularly like with driving, if it were someone who worked in a hazardous environment, like in a plant or even on like a construction site, you have to be more leery of like other people walking around with construction materials or working around heavy equipment, making sure you don't accidentally brush into like a conveyor belt or something that could be dangerous.
What about moving around in like crowds of people?
It could make it more challenging, definitely. You'd have to definitely do more scanning, which scanning means you're not only moving your eyes back and forth, but also you'd have to be turning your neck from left to right so that you can use your left field of vision to compensate.
Do people who've lost an eye sometimes like inadvertently bump into people that are on their the side where they've lost the eye?
Yes.
And then when that field of vision is, I'm trying to ask this question in a way that makes sense. If I mess it up, let me know. But what
Okay.
does someone see like in that 25%? Is it just all black or is it like blurry and they still see something, or what does that look like?
No, it would be completely absent. So like if you were looking straight ahead and a normal field of vision is you can see about 180 degrees, they would be losing, 25 to 30% of that. It would just be smaller.
Okay. Does losing an eye affect depth perception?
It does. You can only have depth perception when you have two eyes that work together, because your brain has to get images from each eye and overlap those, and then your brain turns those into a three-dimensional image. So you cannot have normal depth perception with only one eye.
I wrote down a medical term that I found on the internet or in an article somewhere. Is that the loss of what's called stereoscopic binocular vision?
It is.
And how, in a sort of practical, everyday sense, how might that affect somebody?
So it will make it, if they were driving, particularly on a rainy day or at night, they'd have difficulty with judging how close they are following behind a car. If a car braked in front of them, they would slam on their brakes because they can't judge the distance as accurately between their car and the one in front of it. Going down stairways or stepping off of a curb, they could have more difficulty, judging the height of the step. So maybe be more likely to fall or stumble.
What about using machinery or using tools or like ball sports, baseball, football, anything like that?
Yeah, I would expect them to have more difficulty catching a ball. It's going to be things that you're doing in free space. So if you can do something with like on a table where there's a background behind it, and then you use what's called monocular cues to help you figure out the distance. But anything like catching a ball just in open air, that's definitely going to be more challenging.
This one's a little harder to quantify, I think, but can people who've lost an eye experience sort of social effects as a result?
They can. They'll not want to make eye contact with people because they'll be concerned with the appearance and wondering if people are going to instantly know that they've had an injury to the other eye. They've done studies in the past where people will either have a disfigured eye or an eye that crosses, which people have called in the past a lazy eye. And it's actually recommended, especially in kids, to go ahead and do surgery to straighten those eyes so that they'll develop normal social interactions with making eye contact.
Okay. Are people who've lost an eye subject to sort of certain risks that people with two eyes don't have?
They would have a more likely chance of ending up completely blind because they don't have the spare eye that other people were born with. So if they were playing a sport, like one that's common would be basketball. A lot of times you get fingernail injuries to the eye. Could be from paintball would be another one, any kind of a racket sport. So they really have to be more conscious of wearing eye protection and even possibly completely avoid some of those activities.
What are some of the things that what I'm going to use another new word I've learned? What does monocular mean?
That means you're only using one eye.
Okay, so Mr. Zelaya is now a monocular person, right?
Correct.
What are some sort of what are some ways in which a monocular person has to be sort of extra careful to preserve their remaining good eye?
So one would be like if he's doing yard work, he has to be extra conscious of having on eye protection. If he's even walking by someone else who's using a weed eater, he would need to have on some type of eye protection. Normally people use that by just wearing polycarbonate lenses, even if they don't need it for the vision in their other eye, but just to always have protection. I would not recommend contact lenses really for someone with one eye because they'd have an increased risk of possibly going blind if they got an infection in their remaining eye. They'd be at increased risk from having problems with diabetes or high blood pressure. So if they develop retinopathy, they could end up completely blind.
What's retinopathy?
Retinopathy, that's the complications you can get in your eyes from diabetes, where you get abnormal blood vessels that form.
Okay. Well, I'm about finished with my questions. I've got just a few more. Has Mr. Zelaya been a good patient? Kept his appointment. Let me ask you a question that's not compound before Mr. Spanhauer is forced to object. Has Mr. Zelaya been a good patient?
Yes, he has kept his appointments, complied with all my instructions.
Has he told you the truth so far as you can tell?
Yes, as far as I know.
Is there anything that you want to talk about or think we should talk about that I hadn't asked you?
Not that I can think of.
Have all your opinions been to a reasonable degree of medical certainty?
They have been.
That's all the questions I have right now. Thanks.
Give me 5 minutes.
Yes, sir.
Thanks, sir.
Or up top. This gonna be,
No.
there you go. Okay. Ready.
Good afternoon, Dr. Nicola.
Good afternoon.
Earlier, you testified that when Mr. Zelaya came to you, one of the things that he complained about was pain and throbbing in his left eye. Is that right?
Yes.
And in fact, the reason why you suggested the surgery that you did was to relieve that pain and throbbing that he experienced in his left eye.
Correct.
And then after the surgery, you saw Mr. Zelaya on 2 other occasions. Is that correct?
At least 2, but that sounds about right. I can.
And during those visits, Mr. Zelaya reported that the surgery had relieved the pain and throbbing in his left eye. Is that right?
Let me go to the very last time I saw him, just to double check, okay?
Sure.
Yes, he was not complaining of pain anymore after the surgery.
And Mr. Zelaya's post-surgical course was what you would consider normal.
Correct.
And so you would consider Mr. Zelaya's surgery successful.
I would.
Now, with regard to the decrease in peripheral vision, patients with decreased peripheral vision from the loss of an eye can learn techniques to compensate for that. Is that right?
That's correct. That's like I mentioned, the scanning, moving their neck more often.
And the same with depth perception, right? Patients who have depth perception problems from binocular vision can learn techniques to compensate for that.
I would say for some, but for the things like I mentioned with driving, or even with going up and down a stairs, they're going to just always either they're going to have to be more cautious with driving. And then the same thing with stepping off of a stair or a curb. They're going to always you can't really adapt for that. I mean, you can use a handrail more often, but they're never going to completely adapt to that. Like maybe they would adjust to feeding them, being able to eat and judge the distance with a fork or something.
Well, you would agree that beyond 3 feet, other distance cues can substitute for the loss of binocular vision.
It can sometimes, but again, if there's dim lighting, if you're moving at a faster speed, it's just going to be very difficult.
What Mr. Zelaya experienced was a sudden loss of vision. Is that right?
Correct.
And is it true then that 50% of individuals who had a sudden loss of vision report less than a 1-month adjustment period for activities like driving, work, recreation, home activities, and walking?
I haven't seen that statistics. Is that something in a journal you have found, or?
That's not something you're familiar with?
No, I would think that that's a overestimate at 50%, honestly, based off of my, anecdotal seeing patients here at the trauma center since 2006.
Would you agree that 93% of people question about the sudden loss of vision and their adjustment period reported their adjustment was completed within a year?
I still think that's an overestimate. I mean, I'd have to see the questions they asked them. I'd have to see the ages of who they questioned, because it's going to be slanted towards, younger patients are going to adjust quicker. But I have elderly patients who never really adjust after they've lost an eye.
You would agree that Mr. Zelaya is a younger patient?
I would. He's in his 20s.
Again, when you're talking about risks during sports activities, there are safety measures that patients with monocular vision can take to protect their other eye. Is that right?
That's correct.
And some of those activities or some of those things that they can do include wearing protective goggles.
Correct.
And the same thing with yard work. Individuals can wear safety goggles to protect their good eye when they're doing things like yard work.
Correct.
And you would agree that wearing safety goggles during sports activities where eyes could be injured is a good idea for everybody to do.
Yes.
And you would agree that people who are doing yard work should wear safety goggles to protect their eyes.
Yes.
And if an individual needs corrective lenses and you don't recommend that they wear contacts, they can wear glasses as a substitute. Is that right?
Correct.
I think those are all the questions I have.